there's a certain percentage of the time that they're going to get both A's and a certain percentage of the time that they're going to get an AB or a BB. It's about a 25% chance that this puppy could get an AA, but that's for each puppy. So this dog had a 25% chance he'd get an AA, and this one had a 25% chance she got an AA. So both of these puppies lucked out, and they got no bad genes. So that's a dominant trait. If these parents are positive heterozygotes, you can have two negative puppies. Would I tell you how many tests we've done at this point and the population breakdown of negatives, heterozygous, positives, and homozygous? Absolutely. As of today, we've run 1,026 tests. That is approximately 7% homozygous, 39% heterozygous, positive, and it is 53% negative. And so usually I feel pretty good when we've done, we found mutations in other diseases, cats and dogs that have heart muscle disease, and my experience has been that usually the first 1,000 is pretty consistent with what it's going to be, because you never know when people start sending you samples, it can be very biased. Perhaps people that know they have a problem send in a bunch. Perhaps it's the opposite way, that only people who know they don't have a problem send in samples. So I don't like to look at the numbers too early on because I don't feel like it's a representative sampling. I usually think once we've got about 1,000 that ends up being pretty realistic, and so I think that those values are pretty good. Here's a question from somebody, very helpfully, who's offering us heart tissue. We greatly need heart tissue as well as actually skeletal muscle tissue from affected or unaffected dogs that are dying. Why that is so helpful is not really so much to verify this mutation, but samples, tissue samples, are very important for us to be able to figure out what sort of recommendations we might be able to make as far as diet and exercise and that type of thing. If we can look at the amount of abnormalities in the tissue in affected and unaffected dogs, that's extremely helpful. We have some tissue from people that have sent it to us before when they were having their dog put to sleep, and that's extremely helpful, but we can definitely use more. Now, in order for us to be able to use it for the protein and RNA samples, it should not be put in formalin. We actually have to send you a special solution, or it has to be immediately taken and put on dry ice, which is very hard for veterinarians to do, because most of them don't keep dry ice in their practice. But if you'll be so kind, if you happen to have an affected or an unaffected dog that is getting close to a point for, unfortunately, whatever disease process is, but you're thinking that you might be putting it to sleep in the near future, we would love it, and we'll certainly acknowledge all your help in the future. If you send us a quick email, we'll send you out this special solution. It's not dangerous, can safely be sent in the mail. Your veterinarian just needs to take a little piece of tissue. We'll send some instructions. Just put it in the solution. We'll send you a FedEx label, so we'll pay for it to be shipped back, and that would be extremely helpful. So both affected and unaffected. So is this like the chances of coat color? A little bit. There's a mathematical formula to it, but it is a lot like coat color. So, for instance, if we go again and we say you bred a dog with 2 good genes, you bred that to a dog with 2 bad genes, homozygous, all of those puppies will then be heterozygous because they'll all get 1 good gene and 1 bad gene from their parents. Now, on the other hand, if you breed what I like to recommend, if you happen to have a positive heterozygous, but it doesn't appear to show disease, has no long-term family history of disease, so it may have low penetrance, and you breed that dog to a negative, so A and B, you're positive heterozygous, and you breed that to a negative dog. So now what you're going to get are 1 good gene. If you had negative dog, that's this one here, and I bred that to a positive heterozygous up here, I should get 50% negative, so those are good dogs, never have the disease, and 50% that are positive heterozygous. Now, hopefully you've made this choice because your dog is positive, but it appears to have low penetrance of disease, so this dog is not yet showing disease. But remember, the chances of this 50% negative and 50% positive heterozygous, is what happens every time each puppy is formed. So that puppy is a 50% chance of this or 50% chance of this. That does not mean that if you have 4 puppies that 2 will be negative and 2 will be positive heterozygous. You could have all the puppies are negative, you could get lucky, you could get unlucky, and they could all be positive heterozygous or any other mathematical formula. It simply means each puppy has a 50-50 chance. Did they hear me correctly say there's no relationship between dilated cardiomyopathy and hypothyroidism? There's sort of 2 ways to look at this. Hypothyroidism does not cause dilated cardiomyopathy. It never has. Low thyroid can cause the heart rate to slow down a little bit, but it has never had an actual, generally clinical hypothyroidism has not been shown to decrease cardiac contractility in dogs. Now, this particular gene, PDK4, the gene in which we found the mutation is, does have some, thyroid does have some control on it. So it may be that if your dog is positive for the mutation and is low thyroid, that might make it worse. But just strictly speaking, in dogs that are negative for the mutation, low thyroid, even if it's quite low, clinically low thyroid, where the dog is otherwise walking around eating, should not affect its cardiac contractility. It can slow the heart rate. Next question is, given that Dr. O'Grady and Calvert estimate that 80% of the Doberman population carries dilated cardiomyopathy and that your test shows more than 50% negative, is it probable that this mutation is not responsible for the majority of cardiomyopathy in Dobermans? No, I don't interpret it that way. I think the world of both Dr. O'Grady and Dr. Calvert, but those numbers, that 80%, is based on a rough feeling of dogs that come into the hospital. There's no data, no large population data that says that at all. There may be a sense, well, I had a veterinarian that went out and tried to screen for this and they found 80%. Remember that people that come in for these type of studies, like they go to Dr. O'Grady or go to Dr. Calvert, those populations are biased. Those are people that may know they have a problem in their line or, they're concerned about it. So anytime we do a university study where we're offering tests and you come back annually and it's free or a lower price, we are biasing the population. You ask general practitioners in the state of Washington, you ask the veterinary cardiologists at Ohio State, they say they rarely see Doberman Pinschers with dilated cardiomyopathy. We honestly do not know. There is no data that tells you the prevalence of this disease and the overall population of Doberman Pinschers in the world. We have estimated some populations based on, well, of the dogs that come in for the free study, I kind of think about 80% of them have it, but that's not based on how many dogs in Wisconsin have it or Texas, or we don't know. You went out to look at every dog in a veterinary practice. We have no idea about that. When I look at this data, I think 50% of dogs, I think that's high compared to I've been a cardiologist since 1990. I think this is higher. When I was doing free studies and had people come in, I think this is higher than I saw. So I actually think this is a very important genetic mutation. You can say, well, of course I'm biased. I do think there are other causes of this out there, but if this was not an important one, I doubt we would have had the statistical significance to ever find this mutation, because we had to have it pop up in enough affected dogs to have a pretty good statistical sense there was something there, and the statistical perspective of this evaluation was extremely strong. P-value of 0.0001, which is really strong. Next question, tissue samples I sent a long time ago were at OSU, but I do have to say, which I really appreciate, many people sent us blood samples and tissue samples all along the way while we were working on the study, and we started this study in 1995. And so, unfortunately, because it took us a long time to find this study, if you sent us tissue samples or blood samples along the way, even if you sent them to us here in the past year or so, it is very likely we used up all of that sample in trying to make the discovery. So, sometimes people will say, well, what are the results of my dog? I sent you a sample in 2003. We had to use up a lot of DNA and tissue to find this, because we had to look at a lot of things that turned out not to be important genes to make this discovery. So in many, many, many cases, those samples, unfortunately, are all used up, and I know it's disappointing if the dog is deceased, but unfortunately it's all gone. Next question, is this isoenzyme you identified also present in skeletal muscle? This isoenzyme, PDK4, is also important in skeletal muscle, and so that's why I would like to look at skeletal muscles to see what it looks like in those cases. There's always been a sense, and when I've talked to other veterinary cardiologists about this mutation, their sense has been that in many of these dogs with these failing hearts, they also have muscle wasting that they generally have attributed to having advanced disease, and now we wonder whether it's because this particular gene also affects skeletal muscle. But we don't actually have any skeletal muscle samples to evaluate, because unfortunately that didn't occur to me years ago, so I never collected those. And that's another reason why, if you're unfortunately, if it's going to be an unfortunate situation in the near future where you may have to euthanize a normal or affected dog, it would be very helpful for us to be able to send you some of this solution to ask your veterinarian to collect a very small piece of skeletal muscle. Doesn't have to be they don't even have to do a full necropsy. Just a little skeletal muscle and a little heart tissue would be very helpful. If there are other isoenzymes in the heart tissue, would they be able to take on the role of the missing enzyme and account for the variable penetrance? Yes. So of those four, PDK2 also is quite involved in the heart. And actually right now, and that's one of these reasons it would be very helpful to have tissue, is we have a kit that looks at PDK activity of the different isoenzymes as well as PDH. And we have some samples, and so we're doing those testings right now, but it would be better to have more samples. But I think that's a really good question. I do think that PDH and the other isoenzymes of PDK are manipulated and probably do jump in here a little bit, and so we're working on that. This person wants to know, if a dog is negative for this mutation, could it have a mutation in one of those other genes that we know cause the disease in people that we have previously looked at in our population of dogs? Unfortunately, yes. And so that's kind of the complexity. It's what we need to do is collect all the dogs that are negative for this mutation but positive for the disease, and then go back and look at some of those things we've already looked at in this pool of dogs. Now, that's a pretty labor-intensive, expensive process, and so we may look at other ways, of doing that. But it certainly is possible. It's also possible they have a completely different gene, not even one of the 24 that causes it in people. In the boxer, when we found that mutation, that was a different gene than causes the disease in people for that form of cardiomyopathy, but it has the same function as the genes that cause the disease in people. So it might be. Is it possible for a dog that is positive homozygous for one gene to test negative for the other 24? Yes, most certainly. But I will say in people, they have identified some cases where unfortunate individuals have at least 2 known mutations that cause the disease, and they tend to have a very bad form of it. But there are enough of these genes that cause the disease that sometimes just randomly 2 people that have families that have different genetic mutations for disease meet, have children, and those children end up having both mutations. So all of those combinations are possible. Here's a 10-year-old male who's tested positive homozygous. Based on his Holter and loss of many litter mates, they started him